I am the Regional Director for WWF in Africa. I'm pleased to welcome you today to our Connect to Earth Global Health Talks. So, amidst the COVID-19 pandemic, the fragility of our way of life and the challenges and opportunities for nature conservation, food security, energy supply, and healthcare are more apparent than ever. Disruption of forests, rapid urbanization, and population growth are driving zoonotic events simply by increasing close contact between people and animals. Zoonotic diseases caused by RNA virus spillover, such as COVID-19, are linked to human activities and transformation of ecosystems. So today, our special guest is Dr. John Amuasi. Dr. Amuasi is a group leader of the Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine, and is passionate about research that focuses on improving health systems, services, and outcomes, including policy analysis, both primary and secondary data in low and middle income countries. Fighting COVID-19 could cost us 500 times as much as pandemic prevention measures. So obviously, it would be much smarter and, of course, more ethical to prevent such pandemics from emerging. But how could these future pandemics be prevented? Once again, welcome, Dr. Amuasi. I have a few questions for you, which I will start off right away. All right, so you are the co-chair of the Lancet One Health Commission. Tell us, what exactly does One Health mean?
Alice, good day to you, and good day to everyone who may be listening right now. I must say that have no better time to be engaging in One Health than the times we are in right now. And quite interestingly, if you had asked maybe in November 2019 what One Health is, you may have gotten a slightly different answer from me and from other experts than what you get today. Because now more than ever, we have been compelled to really dissect One Health, look into it, and see what this should really mean. So One Health invariably has undergone two things: more visibility, as well as a more critical look at what it really is. So I would describe One Health as an approach. Really, it is a way of thinking. It is not, to me, a discipline. It's not really a way of doing things. It's almost a way of life, where you take into consideration the health of all living things on the planet. And we normally like to divide these into the human species, and then the non-human species, otherwise known as the animals, and then the environment which we share. Now, what is key to One Health is this shared environment and the intrinsic interconnectedness of all living things on or within this shared environment. So I would say One Health really is an approach, a way of life that takes into cognizance this interconnectedness between all life forms within a shared environment, with the intent, of course, of promoting their health and the sustainability of this shared environment.
Yes, indeed. Thank you very much. It's very interesting when you talk about the change that the invisibility that it has undergone, and the fact that back in November you could have told me a different story, and now when I talk to you now, you do tell me this. So do you feel people are becoming now more aware of that interconnection between the loss of biodiversity and the outbreak of zoonotic diseases?
When you think about One Health today, and the interconnectedness that is shared among the species, I think now more than ever, we have achieved a better consciousness of what has always been. I was making mention of the fact that we like using themes like reconnecting or reconnectedness and rediscovering, that kind of thing. But the truth is, this interconnectedness is intrinsic. It has always been so. It is us, largely the human species, that has failed to recognize this interconnectedness, although our forefathers, for that matter, always knew this in their ways of life. We sort of, with our technological and economic advancement, pushed this to the side and have so much disconnected ourselves. And it's just like if you try to cut yourself free from what really is the source of your life, you will eventually die out. And that's what we are discovering today, that we are possibly going to extinguish our own selves if we continue in this trajectory. So we are rediscovering what has always been our fundamental interconnectedness, and we are finding ways, even though we have drifted so far away, of making sure that this interconnectedness is recognized in our way of life. It's not different in Africa than it is anywhere else in the world, whether you're thinking of the built environment or the naturally occurring environment. It is all still the same. This interconnectedness remains the same. Of course, we express these in different ways, in our different ways of life. Pastoralists would express this differently. Those who deal more with plants and more agriculture in the way of plants and vegetables would deal with this very differently. But this fundamental interconnectedness is there for every human being and for every life form, for that matter, and needs to be focused on if we want to remain sustainable on the planet.
When you say that, I think the connection between human health and animal health, at least from the animal health, has been more prominent in the environment. And nowadays we're starting to really push the environmental health to come to the fore. Do you feel that the COVID-19 has definitely emphasized these broader connections? And has it helped our understanding on One Health in general going forward? That means for Africa generally.
No, Alice, I think that's another great question. I like to dissect what has happened, into two. It has been positive in the sense that there is an increased awareness of One Health, the interconnectedness between human beings and animals. We know what the most likely history of SARS-CoV-2 is, in that it most likely came from bats to human beings. And so we also know what happened with the Ebola crisis in West Africa, where again, it was the bats that were implicated in Guekadu, in Guinea, and then moved on to human beings. And we've seen several other examples of epidemics and pandemics which are of zoonotic origin. What this has done, it has, as I said, accentuated this intrinsic relationship between human beings and animals. It's given an increased consciousness, and it's allowing us to better appreciate the power of integrated approaches to being able to surveil, to detect early, to prevent, and to also to control, even though it may have emerged already. But the other thing that this has done, which we really need to watch out for, and I feel we're not talking enough about, is it has created a sense of them versus us, all right? The bats are bad animals that are transmitting all these bad pathogens to us. So we must, as much as possible, separate ourselves from these bats and all these other animals which are causing us trouble. But it really doesn't work that way. So in as much as we acknowledge these transmission patterns and this link between human and animal infectious diseases, we also need to be very careful that we don't create a them versus us scenario, which will ultimately take us down the wrong path. Of course, not for us who may be scientists and researchers who may appreciate better, but for the general public to really know that it's not about them versus us, but we're all in this together in a shared environment. It's largely us who've been doing the wrong thing and have brought this upon ourselves.
You know, when COVID-19 when we first had the outbreak, the pandemic, there was a lot of talk about banning the illegal wildlife trade, or banning trade in wild animals. And you and I know that there are some communities in Africa where bushmeat is very much a cultural delicacy. It's also a source of nutrition. And so how do you balance that with the other discussion of you ban this illegal trade in wild animals because it exposes humans to disease? How do you balance those two discussions?
Well, that's another great question, Alice. You know, this problem, if I call it, of anthropocentrism first, and then also the problem of cultural insensitivity needs to be tackled head on. We start with the anthropocentrism, where we see the human as the center of it all, and the focus is solely, I didn't say ultimately, solely on the preservation of human health, down the consequences and on all the others. and a failure to recognize that human health and sustainability cannot be pursued outside of the sustainability of other species and the environment we share. So anthropocentrism has to be called out for what it is and has to be addressed head on. The other side of it also, which I made mention of, is this other idea of certain cultures and practices inimical to our health. And we don't recognize that these are ways of living, which, if were actually properly pursued, would even make the environment and the shared environment more sustainable. Our forefathers in different parts of the world did all kinds of hunting and gathering and things that they did, which today we would consider as banned, or we would ban these things only because we went overboard. We pursued these in an unsustainable way. We've hunted species to extinction because of the way in which we've gone about grabbing land that should have been left as it was, and so on. One kind of food, or banning one way of life essentially or the other, is definitely not the response. What I'd advocate for is a culturally sensitive, community-based approach to addressing the risks that we face in interfacing in the shared environment with these animals that invariably carry different kinds of pathogens which could be injurious to us. Also remembering that we also carry pathogens that could be injurious to them, and ultimately has an impact on the biodiversity and the balance thereof, and ultimately comes back to bite the health of all of us in our shared environment.
Yes, indeed, indeed. It's important to put the shoe on the other foot as well and see what is it we also introduce to them. So I want to ask you a bit about prevention. The economic and financial damage that's been caused by COVID-19 is in the billions, as you know, and it's still continuing because we're still in the third wave and we're still going through that. Do you think that the cost of prevention is lower?
Alice, when it comes to cost, it's a very tricky subject. I say this because when you say cost, you're talking about money, the dollars, the euro, the whatever you want to put on it, the pounds. And if you just want to put figures to it, it becomes easy on one hand, but it ignores the inherent complexity that there is within it. But again, the end thereof is what we need to focus on. The preservation of life on the planet, of course, human life, we recognize as being sacrosanct, but ultimately the sustainability of this balance on the planet. And one would argue that no price is too high to pay for this, because the other option is extinction. I don't think there's any price that is too high for this. So ultimately, if prevention, or being able to improve our eyesight, being able to surveil and predict and prevent and control adequately, if we can achieve this, then there is no price too high for it. Unfortunately, the prevailing economic system of our world is inimical to this. We have a world economic system where if you have trees growing in a forest, a large forest in Africa, in any part of the world, it is not as valuable as when those trees come down and are converted into logs. This is the world economic system that we have. The value, the intrinsic value that we have, is not recognized until it is transformed into a dead form. And until we take a hard look at the current economic system and find means and ways of revising this, and it will not come fast, it will not come easy, it will be painful, it will be slow, but ultimately we need to do this. We will need a radical but slow, painful transformation of our world economic systems if we want to be able to achieve sustainability in a way that ultimately we will not be talking about whether the cost is too high or not.
And it costs, obviously, it costs more to treat a pandemic, which is what we're trying to do at the moment. than it would have cost us had we invested much more into biodiversity and to nature protection and reducing biodiversity loss. Wouldn't you agree?
No matter how you slice it, historically, if you look at the value of prevention, the value of control, it's huge. Even if you look on the veterinary side, the savings that have been made from eventually eradicating reindeer pests globally, huge savings. Look at the economic losses that were put on the world, and particularly in China, over 140 billion when the African swine fever, or the swine fever panzootic hit the Chinese mainland. Look at COVID as it is today. So I think it's pretty clear, and I totally buy the hypothesis actually the proven hypothesis that it is ultimately cheaper to invest in prevention and control than it is to wait and just allow things to pan out. Some countries took a rather interesting approach, just saying, okay, we'll sit this out and see where it goes. They very quickly had to change course because they realized that, look, if we don't invest heavily in preventing further and controlling what already has happened, we're going to be in a big mess. And we've all seen the difference that those turnarounds have made.
Thank you. No, that is true. Maybe to push that one last point on this would be, sure. If I'm as a president of a country, I asked you to tell me the 2 things that I need to do for prevention. What would those be?
Well, for me, I would tell any leader in Africa to focus on a regional and a Pan-African approach. It doesn't work when you go it alone. You cannot insulate yourself and seal your borders. We're not safe until everybody's safe.
Good. No, excellent. Solidarity. You're talking about solidarity.
Absolutely.
Yes, and in one area that has also obviously even prior to COVID-19 and even after COVID-19 that has been at the forefront of many of our countries is climate change. It's been the scourge of our nations, and we keep talking about the fact that we need the same level of solidarity as we head into the climate change COP in Glasgow as we need for solidarity around vaccines. But do you see any similarities there in terms of the way climate change has really impacted, of course, in our local communities and how COVID-19 has come in and exacerbated us? Do you see any similarities in the approaches that we need to take?
Alice, I think that there are many similarities there, and climate change cannot be divorced from all that is going on today. Perhaps over the past couple of weeks, we've seen the stark realities and how climate change that occurs over a protracted period of time can very suddenly present us with catastrophic scenarios. We've seen this in Europe with the floodings, in China with the floodings, also with the unprecedented weather conditions we experienced in Africa about 2 years ago in Mozambique, and several other natural disasters, the fires that we've seen in North America and in Eastern Europe, in Russia. I mean, all these are clearly on account of climate change, but they occur suddenly and they get exacerbated ultimately. What we're seeing with COVID, and very interestingly, during the global lockdowns, if I call it that, we saw how our environments changed all of a sudden, even with that very sudden change in our ways of life on a global scale. We saw the skies being much cleaner. We saw the animals thriving. A lot of people actually said that they did feel better, apart from the mental health issues of isolation. They felt they were breathing cleaner air and all that. And all these will translate ultimately into the risk for disease, because there's a way in which all these extraneous factors impact on our susceptibility to disease and our body's natural ability to withstand the pressure that comes from pathogens. And so ultimately, climate change will also have an impact on biodiversity, which has also an impact on the balance of pathogens and other infectious diseases, also has important implications for non-communicable diseases, which we are slowly bringing more and more into this discourse of One Health. And so ultimately, the connection between climate change and health, so to speak, has been clearly established. And One Health, because it is intrinsically focused on humans and animals and the shared environment, and the shared environment clearly is linked to the climate. We cannot divorce a One Health approach from climate change. It really is an integral part of it.
That's really good, because then it at least shows that the efforts that we are putting towards climate change can also have One Health benefits, and vice versa. The efforts we're putting towards a One Health approach can also have climate benefits. Thank you very much for your very, very useful discussion today. Very important points that you raised.
Thank you very much, Alice. I think I will like to thank you to you and to everyone listening. It's really a pleasure to have come your way. I hope this was helpful.
It was very helpful, and I look forward in the name of solidarity for us to be able to look at ways we can all work together for a Pan-Africa approach to One Health, but also to supporting our governments to really put in place better measures going forward. Thank you very much.